Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Homecare Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Homecare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You, and I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Park Money Radio Studios, 1510 AM, 105.3 FM, World Wide Web, moneyradio1510.com, and we now are coming at you through a podcast, which is really exciting. So if this is the first time you've tuned into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here to Health Futures. And it's not to me, it's to these extraordinary guests that I get to come onto the show. And for me, I have a good friend who was here in the studio came in via technology on our show almost 3 years ago. It was January of 21. And I'm so happy to have her back. I have with me Vicki Hoak, who was the president and CEO. Now she's the emeritus for Homecare Association of America, and also formerly with the Pennsylvania Homecare Association for over 20 years. My dear friend, Vicki Hoak, welcome back to Health Futures.
Oh, Bob, thanks. It's so nice to be with you.
Well, it's good to be with you as well. And, I couldn't think of anything better with your departure at the end of this month than having you here on the show. And, I said before we started the show, we can't let you get away. We need you. Home care needs you. You have been a trailblazer. You have really set the bar for all of us to follow. You've been an incredible CEO and president of our trade association. I can say this from having been a board member for 6 years. You reshaped our board. You reshaped our trade association. We barely were able to put it all together at the end of every year. And, now we have profitability. We have goals. We have missions. We're doing a lot of great things, and it's a big tribute to you. So thank you, Vicki Hoak. It means a lot to me.
You're
and
welcome.
And it means a lot to me to have you here on the show. And I really, it's interesting. I'm getting a quick glimpse of your bio. I know that you were the Pennsylvania, Homecare Association CEO for, I think it was 20 years. But I also, you began your career at the American Cancer Society. You worked as a press secretary for Governor Robert Casey. And wow, you talk about a guy who is a friend of home care. Bob Casey.
His son, absolutely.
Yes, big time. You were a public affairs director for the Pennsylvania Bar Association. You've done a lot in your lifetime. And, I think for me, and I hope you feel the same way, this was the cherry on the top, what you did for us.
Absolutely. I found my home when I found home care. Yes.
Well, and for our listeners, they don't know this, but you did retire once, and we brought you back out. Kind of reminiscence of some of our ball players, like Tom Brady keeps retiring in coming back out. So I'm kind of hoping.
Yeah, I'm not. Yeah.
I'm hoping you could pull us a TB12 and, 6 months from now, all of a sudden reappear somewhere, but somewhere in home care. But I really want to talk about home care and talk about where we are today and how far we've come and yet how far we still have to go. It's interesting. And you and I, we say a lot of the same things. I mean, we are, it's funny. I say the Rodney Dangerfield, the group today doesn't know who they are, but we are the Rodney Dangerfield of the healthcare continuum. We get no respect, but we are the ones that are there in the home. We are the ones that see the change of condition. We are doing things that are just making a difference in the way people age and the way people live out their lives.
Yeah, and when I think back over, I guess right before talking with you, I was thinking about, I've been in this business of representing and advocating for home care now for close to 25 years. And when I think back, I literally came into this business in late 2000. So fast forward to 2023, and I was thinking, we've come a long way. That old proverb that says the more things change, the more they stay the same, though, is still really relevant to what we're looking at today as far as home care is concerned. But one thing that I am just really proud, and this really speaks to the commitment of all of our home care owners and providers, is the fact that we are getting noticed more than we were, Bob. And is it where it needs to be? Absolutely not. But I always, my indicator is, do people who need us know about us? When a family has a loved one coming out of the hospital and they now are going to be living with a chronic condition, do they know about home care? Do they understand what we can do for them? And I think this is much better than we were when I first entered the field of advocating for home care. I also think, the home care that your agency does represents and bringing the non-medical, the supportive care into people's homes, that's the sector that we continue, though, to have to remind people is really the care that does indeed enable people to stay at home. Because our home care workers are in your home for not just the 1 hour, like so often a home health care nurse, and that's not to say anything bad. Oh, my goodness, Bob, you know how vital home health care is, right?
Yes.
But I'm talking about a home care that stays with like when my mother lived with me, that stayed 8 hours a day while I worked. And when you don't have family, that's who enables you to stay at home and grow old in your home where you raised your kids and you love your surroundings, your friends are there. And that's the message that we still have to keep reminding people about.
No doubt. And I love the fact that you shared your personal story. I think all of us have that. And you were in the business already. But, I mean, that was just affirmation for you that, hey, not only do I need this, but so many others do. And we get lumped in. You mentioned home health. And even to this day, it just boggles my mind that clinicians, social workers, case management, they still don't know the distinction between home health and home care.
Right.
It's crazy. We Rodney Dangerfield or not. I mean,
yeah.
we have 1/3 of our population 65 and over that is living alone and doesn't have anybody there to assist them. And knowing that, knowing what happened during COVID, and knowing that a step-down unit or a post-acute unit could be the end of me because I might get COVID or something else, we know that people don't want to go to those step-down units. They want to go home. And
that's right.
And our biggest challenge we have is the hospitals are packed up. They need to turn the beds. And, you've got a discharge planner or case manager and not to knock them, but, that patient that's there says, oh, I've got family at home, or I've got a neighbor that's going to take care of me. But there's no validation for that. And that person gets discharged, and next thing you know, they're back less than a week later because nobody was there to help them during that transitionary time that was so critical to make that discharge a success.
Oh, yeah. I think, When I look back, I also think that I think there is now a heightened understanding of in-home care. I think, music to my ears was when President Biden talked about home care in the State of the Union address in January. I mean, I used to dream about that 20 years ago, right? But now we do have a president. We have many senators, many congresswomen, congressmen talking about Americans' rights to receive care in their own home, and how the care in their own home is usually much better for them. It's one-to-one care. And I think that's the other thing that we still have a lot of work to do when it comes to making sure families understand that they need to plan ahead for their long-term care needs.
It's so true. And I wrote a column in the local paper here about that nobody really thinks about that. They think that the federal government, Medicare Advantage, the Medicare supplement, managed care is going to pay for all this. We disappoint at least 50% of our callers because they think that that's how they're going to pay for our services.
It's so true.
Well, you hear the music. You've done this with me before. We're one down. We got 3 more to go. You're listening to Health Futures, Taking Stock in You. I got Vicki Hoak with me. I'm so excited. I don't want this to be your swan song, but I want to make sure that you and I get time together on the air talking about something so dear and important to us, and that's home care. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I got Vicki Hoak here in the studio with me. Vicki is a dear friend of mine, and she is just sunsetting her career right now with the Homecare Association of America, HCAOA. And if you missed our first segment, go up to our website at cypresshomecare.com, click on the media button right below its radio show, and you'll catch this one and many, many more. So we got a chance to talk a little bit about the break. We were talking about how, in the first segment, how important home care is, and we concluded by talking about how Americans are not prepared for long-term care supportive services. They have not a clue on how much it costs, and they have not saved enough money, and they think that Medicare is going to pay for it. They think that maybe they can easily qualify for Medicaid, which is not so easy to qualify. There are 4 payer sources, and I say this all the time. It's private pay, or some call it family pay. It's VA benefits. It's long-term care insurance, or Medicaid. Those are the only resources. We got really excited in 2018, Vicki, when CMS announced that Medicare Advantage plans were going to offer in-home care supportive services, but even though they do, it's really hard to get. The prices are really low for providers like me. And when I say it's hard to get for members, they're only authorized 60, maybe 100 hours per member per year. So that's not really long-term care supportive services. It's more, it's more akin to transitionary care, right?
Right. But you know what, Bob? I think I still have hope that this is brand new. Remember when, government does not go fast. Right?
Right.
And think about it. These were health insurance companies that all of a sudden now were able to pay for non-medical kinds of services. We just got done talking about how people don't quite understand what home care is versus home health care. And I always say home health care, medical care. Home care, non-medical, supportive, personal care. So I think there has been a slow uptick by MCOs. And I also think our providers are not used to or not accustomed to billing a health insurance company.
Right.
So I'm still holding out hope that that's going to continue to grow. CMS has done some proposed rules around just what are MCOs now paying for when it comes to supplemental services, specifically in-home support, which is what we do. And I think you're going to start seeing that Bob, you and I always say we need data to prove our value.
Mm-hmm.
And if we can start saying that 4 hours of non-medical care 3 times, 2 times a week. Look what we've seen. And Bob, I think you've had some success.
Agreed.
And we have seen a decrease in hospitalizations. We have seen decreases in falls and, UTIs going crazy and things like that. I think that it's going to start picking up. I'm going to keep my fingers crossed.
Well, me too. And there was a bill that was introduced last session. You and I are familiar with Bruce Greenstein over at LHC, and they were leading the charge. And it was nice that our brothers and sisters over at Home Health realize how important the work is that we do, and they put us into that bill. And we were talking up to 90 days that CMS could pay for in-home supportive care services. So even though that bill didn't pass, I mean, I think it's a start. And you and I both know great bills don't always pass right away. They evolve over time. So whether it's next year or 5 years from now, hopefully we will have a mechanism in there where people can tap into that benefit, that they are entitled to through the Centers of Medicare and Medicaid Services.
Right. And I think the other thing that is important, not only do they pay for now, in-home supportive services, which is personal care, but another supplemental service that is pretty popular is family caregiver support.
Right.
I always say there is no other healthcare provider, none, that relies and depends on a relationship than home care does with family caregivers.
Well,
you cannot have a great home care experience without having a really committed family caregiver, right?
Well,
so we need to do whatever we can to support them.
When you have 54 million of them, that's how many are out there caring for others.
That's right.
It is, that is our workforce out there. And I've heard a lot of people talk about that, and it's so true. We need to tap into that. It's a great segue. I talked to you a little bit about this at the break.
Sure.
So we're a Medicaid provider here in our state. We've been a provider for over 20 years, probably close to 25 years. In April, we'll be celebrating our 30th year. And our state allows for family caregivers to do the Medicaid work. And, thanks to the waiver program, we're able to do that. And family members are able to be there for their loved ones. But, it comes with a lot of challenges. I mean, the challenge is that they can't leave their loved ones. When there's a change of conditions, it's really hard to get them over to the doctor's office. So, you know what? Our state's Medicaid had some excess money from COVID through the American Rescue Plan, and they put out a $40 million innovation grant to the community to help serve their population differently, a demonstration grant. And I did a submission with 2 other vendors that One was a online training platform called Navan, and the other one was a digital telehealth solution called Pocket RN. And the goal was a triad approach where we would give the family members the tools that they need. Because as you can imagine, it's really hard for us to have a family member come to Cypress and do a training, high lift and transfer, dementia training, Parkinson's training. We can't do that because they can't leave their loved ones. But imagine an online platform, a training platform like Navan, who can break it up into like 15-minute segments, or 20-minute segments, and they can digest that through their devices, whether it be a tablet, whether it be their computer or their phone, and learn how to better care for their loved one is huge. And then on top of that, Pocket RN, partnering with them, having a digital telehealth solution so the family member, if they see a changing condition, can get a nurse in less than 3 minutes on the phone. And not only be able to figure out and mitigate whatever's going on, discern what's going on, but also have a plan in place. And that nurse will proactively set up appointments to check in to make sure that that person is doing much better. And if need be, they have partnered with nurses here locally, and we can have a nurse come and visit to the homes.
Great.
So I kind of see that not just for Medicaid patients, but this demonstration grant, we're hoping really opens up the managed care organizations, because that's who manages our Medicaid in our state. So we have United Healthcare, we have Aetna through Mercy Care, and then we have the Banner University Health Plan. We can enlighten them that this is a new model of care. This is the way we should be caring for our elderly. And as I shared in the first segment, 1/3 of our population, 65 and older, lives home alone. Dr. Joseph Coughlin from the MIT Age Lab says between 2040 and 2050, that number may eclipse 50%.
Yeah, absolutely. But that's great. I think so often family caregivers, we're asking them to do pretty significant things, and they don't feel like they have the proper training or the proper support. So I think that program is perfect, Bob. That's great.
We're excited.
Good for you. Congratulations.
Well, thank you. But the other challenge that we have, and we know this from the Value of Home Care report that Homecare Association of America put together with the the Aging Coalition, the Older Aging Coalition.
Mm-hmm.
We did
we did in
partnership.
Global
Coalition. Coalition. We did it in partnership with them. We know that the average distance between an adult child and their parents is 280 miles, and that becomes really challenging. That's where professional home care agencies like ours, I always like to say on the radio here, friends, family, neighbors, and when you can't find them, you want to call an employer-based professional home care agency that's established in the market to really help you with that loved one. Yeah,
I think that's so important. And I think, too, when I think about, we talked about family caregivers. We talked a little bit about our workers, which we know, that proverb that I started with, the more things change, the more they stay the same. 25 years ago, we were talking about a workforce shortage. Now we're talking about a workforce shortage. It's much more, I think, acute since the pandemic. But at the same time, I had the privilege of holding a focus group 2 weeks ago with 16 of our finalists for the Caregiver of the Year award. This is an award that's given, every year.
Well,
We've had over 500.
I'm going to pause you right there, because that's a great tease for our listeners, because this is a prestigious award recognizing these heroes that really give up their lives and are selfless in what they do. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Vicki Hoak here with me. We're down one half. We got a second half to come. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here. And I got Vicki Hoak in the studio, actually via technology. I've got her on my computer, and I got her via telephone. And Vicki is the CEO Emeritus for the Homecare Association of America, and a dear friend. And if you missed that first half, I definitely want you to go up to our website and take a listen. You can find it up on cypresshomecare.com. Click on the media button. Right below its radio show, you'll catch this one and many, many more. So when we ended our second segment, our first half, we were talking about how caregivers are the ones that are making the ultimate sacrifice and making a difference in people's lives. And, the Homecare Association of America recognizes one Caregiver of the Year, but they also recognize all the nominees. And there were a lot of nominees to choose from. And Vicki began talking about that. And then the darn music came on, and we had to cut her off. So I want you to pick up where you left off, really talking about the focus group that you had and the time that you spent. You spent a couple hours talking to, I think you said it was 16 finalists.
Yeah, we had 16 finalists. But I think that the message here is that when we talk about home care, and I think, Bob, you would agree with me, that the core are our workers, those that go into the home and take care of your mother, your father, uncle, whatever. And, whatever we can do to recognize them And so we have this yearly program where people submit nominations, and this year we had a record-breaking 500 nominations coming in from all over the country.
500.
And then 500, and but
we've
honestly,
come so
Bob,
far.
I'm
We've come
sorry,
so far.
but Bob, there should be thousands.
There should be.
But one step at a time, right?
Right.
So we had 16 finalists, and we thought, gosh, I didn't want to miss the opportunity to just talk with them, to learn what they're thinking, what's important about their job. And so we held a focus group, and we spent 2 hours with these 16 finalists, and I think there were probably 16 different states represented. And these are home care workers that have been nominated by their home care agency owner or their supervisor. And I was so struck by their total, 100% commitment to providing the best care that they can every single day to their client or their patient. And when I asked, what's important to you? Why did you go to work for that particular home care agency? I thought, or how can we make their jobs better? I thought for sure I would hear, that we need to make more money. Guess what? I did not hear that. Now, let me first say, first of all, they do deserve more money. I want to say that.
Right.
But I was struck by the fact that not one of those 16 people brought it up. What they did say was, I have to feel that my office, that my home care agency owner values me, they respect me, and this was the phrase that was brought up so many times, they have my back. That when I need them, I pick up the phone. This is the other thing we heard. When I need them, no matter what time of the day, when I pick up the phone, I want them to answer the phone. And all of them said they do. And then I thought, okay, well, this is interesting because so often the media accounts of direct care workers, and we've all read the headlines, is that, they feel like they're out there, that no one cares about what they're doing, they're not supported, they're not trained. That was not the case. But I also have to really recognize that these are the best of the best, that these are the direct care workers that are coming from the best home care agencies around, and that these agencies know what they need to do to be successful, and that is just to recognize and value their workers.
I love it. I absolutely love it. We talked about in the second segment the shortage. And we, and I say we as Homecare Association of America, need to stand up these heroes and let everyone hear how rewarding their work is. In the state of Arizona, PHI, the Paraprofessional Healthcare Institute, predicts between now and 2030, we're going to have about a 200,000 direct care workforce shortage.
Oh, yeah.
And that's just in our state. We know it. I think the number's like 1.8 million across
million.
Yeah.
When you just take home care alone, not nursing homes or any other senior living, setting, we have 2.4 million home care aides today.
Wow.
And I think the other thing that was very clear that was said more than twice during those 2 hours of talking with our workers, they said the public needs to understand what we do. They're tired of being called babysitters. They're tired of people thinking it's a demeaning job. And I thought that was also interesting, that they are a healthcare provider. And this is why our association feels so strongly about licensing.
Right.
To elevate a profession, you have to have a licensed entity that employs them. And so that's a very, one of our top priorities, and I'm sure it will continue because I think they deserve to be recognized. And in different states, they are credentialed and things like that. And they also mentioned training as being important, and that they really want to be trained so there are no surprises when they go out into the house, to the home.
There are a couple things I want to pick up on. Is first of all, this show gets broadcast out across the internet and everywhere, and it is podcasted as well. So I'm making an appeal to anyone that's listening that has a family member or friend, a neighbor, somebody that is a caring spirit that wants to make a difference in somebody's life. we need caregivers, and it's a great profession. It's an incredibly rewarding profession. It's a great career lattice in terms of breaking into the healthcare sector. That, I've had caregivers that have become nurses, they've become speech therapists, physical therapists. I mean, it's a great way to get in. And that famous movie with Dustin Hoffman back in the 1960s when that guy said to him, plastics are the future. Well, healthcare is the future, and home care is a great place to start.
Yeah.
It really
but vice
is.
versa, right? We're also seeing nurses that are retiring that just really have that compassion that they, used in their nursing career.
Sure.
And now they are thinking, you know what? I want to get away from the medical care, yet I still love to help people. And so we're seeing a lot of retired nurses coming into the home care worker field as well.
And it helps. And I'm not here to bash generations, but this generation coming up is very different from the generation that is retiring. And they're carrying compassionate souls. And I want our listeners to also understand that when a care recipient, someone that is receiving care, opens up the door to a caregiver, they open up their life to them. And, we really haven't talked a whole lot about this, and I mentioned it in the first half, that, there are a lot of people out there that are providing these types of services. And unfortunately, there's some bad actors out there that kind of, they mimic and they look like a home care agency, but they're not. They're not employing. They have contractors, 1099 workers that don't have insurance, that have not been vetted and background checked. And the insurance piece is a big piece because, everyone thinks about professional liability insurance, but it's the workers' comp insurance. You know how many caregivers over 30 years that my company's employed that has gotten injured?
Oh, sure.
And there's something about a bathroom with tile, water, soap, and skin.
Very tough.
It's a recipe for disaster. And you talk about these caregivers, these caring spirits. My fictitious client is Mrs. Abramson. I am telling you, a caregiver will not let Mrs. Abramson fall without trying to catch them and help them.
Right.
And that's where they end up hurting themselves because they're helping the care recipient.
That's so true. You're so right. I know. And I think that, and how many times, Bob, I'm sure your friends and associates call you because they know the business you're in. And over 25 years, I'm getting all of these calls. And they always
all over the
what
country.
Should I ask?
Yeah.
What questions? And you have it probably on your website. We have it on our website, HCAOA.org, where here's the questions you need to ask an agency before you hire. And the most important thing, make sure you meet the caregiver. And if your mother or your father who's receiving the care just doesn't, click, do not hire that caregiver.
Do not.
I just think it's that important.
And a home care agents like us, if you don't like the caregiver, we'll get another one. I mean, that's why you employ us. Well, you hear a little Steely Dan. The thing I like about this station, they always play some really good rock from the 70s and 80s. So I have a little something to do with it. We're down 3 segments. We got one more to go. Vicki Hoak, stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, we're in our 4th segment. I got Vicki Hoak here with me. She's coming in via technology and through the telephone, and we've had a great 3 sessions together. If you missed them, go up to our website at cypresshomecare.com, click on the media button. Radio show is right below it. You'll catch this show and many, many more. So we've talked a lot about caregiving. We've talked a lot about the work that we do. We talked in that 3rd segment, we talked about the questions that you should ask and why you should go up to the HCAOA.org website, because they're great resources up there that you can tap into, and you can make sure that you are working with a reputable company and asking the right questions. In this 4th segment, I want to really talk about the future. And I want to cover, the fact that solo agers, I said that to you during the break, is only going to grow. And I view that as kind of a silent pandemic. The workforce challenge that we have, and we should talk about immigration. And then, I wanted you to kind of give us a lay of the land where you think things are going to land in the years to come. So let's unpack this. Let's talk about, let's talk about immigration, because it should not be a dirty word. And we have this border issue going on right now, and it's not being addressed. But we, meaning us home care agencies, and primarily my colleagues in the East, they get a lot of immigrants that are coming from Africa. They're coming from the West Indies. They're coming from what I refer to as caring nations. And we should make the path for them to come here a whole lot easier than it is right now.
Yeah. And I think if we look to solve or mitigate the workforce shortage, we have got to include immigration. It's one of many solutions that we all know we have to address. And I think we have been working on, legislative language to do some kind of a temporary visa for people who would come to this country and care for people in the senior care arena, whether it be a nursing home, home care, hospice, whatever. We've teamed up with other national associations like Leading Age, the Healthcare Association that represents the skilled nursing homes, to try to fashion some legislative language. Probably 2 years ago, or even a year ago, when I would go to the Capitol, I usually was that, it was like, Vicki, we don't want to talk about it. However, I think in the last year, given the shortage of all industries, and while, we're one, but, hospitality is having workforce issues, restaurants, all of those are having workforce issues. I think there is some softening about, let's take a look at it and see how we can do this logically. We need to reform our immigration system. It's not working. Right now, a third of our direct care workers were not born in this country. So we know that they make good caregivers if they're trained, and we want to provide them with opportunity. So I think that has to come, and I think it's going to come. I really do, Bob, in the next year or so. It has to, right? We don't have workers.
In our market, we have a lot of Filipinos and Romanians,
yes.
and they're running a lot of the care homes here, and they do a fabulous job. Oh my gosh! Yeah. First of all, I've been in many of them, and especially the Romanian homes. Man, they can cook like no one's business. Oh my gosh!
Exactly.
The people that live with them eat very well, and I always say that about a community, and I have this radio show, and I've had some of these really nice CCRCs, continuing care retirement communities here, and I always ask, tell me about the food, because the food is really important. It really is.
Absolutely.
No,
but if we look down the road, Bob, 10 years, whatever, the first thing I would say is that every American needs to have a plan. I always would say, when our kids got to that age and we'd have the birds and the bees conversation with them, well, that same kind of conversation should happen with parents of adult children about what do you want.
Right.
And we've had it with our son. And it is important to plan. And I'm not just talking about money and saving money. I'm also talking about your home, remodeling your home so you can indeed stay, making sure that your, the entranceways are wide enough for a wheelchair, God forbid, but you've got a plan. And I think the second thing is this country has got to develop a long-term care strategy. We really don't have one right now. We finally got a national strategy to support family caregivers that came out 2 years ago, I think in September, talking about the importance of family caregivers. And I always say this about family caregivers, people who are paying for home care, the families that are doing this themselves, have got to be supported. They're doing exactly what we want everyone to do, right? They saved. They're doing the right thing. So how are we rewarding them? Are we incentivizing them? Are we giving them a tax credit? No. We've tried, right? The credit for caring has been tried and tried for years. It's still not passed. but we've got to make sure that families are encouraged to do the right thing. I had the honor of holding a big training session all day for direct care workers back in Pennsylvania. We had about 350 in the room. And I dawned on me as I was talking to them, I said, do you realize that each of you are saving our government money every day you care for somebody? Think about it. Because government is not paying for it sometimes. When families are funding it, that's what we want every American to do. And we also, though, want to make sure, and I think, Bob, you alluded to this when you said, yes, we have had to raise wages, especially since the pandemic. And now when we have to do that for our private pay clients, we also then have to increase our charges. And my fear, and I think it's your fear too, is that we don't want home care to become the care for the rich and famous. Mm-hmm. My goodness, that's the last thing we want to do. So what can we do to keep home care affordable, accessible, and maybe we need to look at Medicaid to increase the eligibility, income levels. Maybe we need to take a look at the benefit cliff. That's the other thing that so often when I talk to home care agencies, they say, well, I have workers, but they're on welfare, and they only can work so many hours without, hurting. And that should not be.
Right.
Welfare should pull people up. They shouldn't hold them back to be dependent on that. So I think that's another thing we have to look at. And of course, we have to make certain that all Americans have the right to bring care into their homes. I think we're heading that way, but we need to make sure. And I think part of that, too, we have to think about technology. Bob, you have talked about some of the things you're doing. I think technology can help us improve the quality of care. And I'm not talking robots here,
right? Because
I still believe there's that human touch. But I'm talking about technology that provides instant advice from a nurse if something goes wrong in that home, or connection with someone to immediately consult with if they have to.
Yep, it kind of a wrap around the live caregiving that's happening, because we can't.
Exactly.
We need humans to humans, people to people. You talked about the homes not being ADL compliant, and you and I have a friend in Louis Tenenbaum, and I've known Louis for probably 20 years, and he's making progress, but we're still not there yet. And I think the data point, he said 2%. I think 2% of the homes are ADL compliant.
Right.
And, so it's like, wow. I said ADA compliant, and we're not ready for this. And I also think intergenerational living. I think that is a key, bringing young people and old people together. You hear the music. Is there a lasting thought you want to leave our listeners? A question I haven't asked. I so have enjoyed having you on.
Oh, Bob, it's been great being with you. Thank you for all that you've done for the home care industry over the years.
Thank you.
And it's been such an honor to represent and continue to advocate so everyone can receive care in their home.
Well, I know that you may be riding off into the sunset being our trade association president and CEO, but you will continue to advocate and help lift up those that are elderly and infirmed. Make it a great day. Have a great weekend. Thank you again, Vicki Hoak.
Thank you.
Make it a great day. Bye-bye.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.